This is 17 News with continuing coronavirus coverage.
Governor Gavin Newsom is streaming live once again to give an update on the coronavirus crisis in our state. He promised to give a live update every day at noon for the foreseeable future. Well, he's in Sacramento and he is providing that update on the state's COVID-19 response. Like I said, he is set to do this every day at noon for the foreseeable future until maybe something comes about. And again, once again, we are waiting on Governor Gavin Newsom to speak. He will be doing this at noon every day for the foreseeable future. And we are getting him right now, so let's take a listen in.
4% increase from the prior day. Why do I start with the number 774? Because that's the number I wake up to that I'm most focused on as governor of the state of California. The number of people in ICU and the number of people hospitalized in the state of California. Those numbers represent our most urgent need in terms of keeping people alive and keeping people healthy and safe in the state of California. It is incumbent that we prepare for a surge in the number of hospitalizations and the number of ICU patients. That 774 may be deceiving. Many of you may think, well, that sounds relatively modest to what's happening in other parts of this country. And that may be true. But it's incredibly important to impress upon you that that number represents roughly a quadrupling compared to where we were just 6 days ago. The number of people hospitalized in the state of California, the number 1,855, represents roughly a tripling of where we were just 6 days ago. It gives you a sense of the nature of the spread and the nature of the attack of this virus and the nature of our focus as it relates to preparing for this surge. I'll remind you that we're preparing for a 2/3 increase in our hospital bed capacity in this state. We are preparing to meet that, not just in terms of the physical needs within that system, but also making sure we have the appropriate protective gear, the ventilators, and, of course, personnel, people. I'll talk more about that in a moment. So today I want to go forward with some more specifics about our modeling, about what those numbers that I've led with actually mean and mean to you and mean to the state of California. I'll ask Dr. Galley here in a moment to provide an analysis of our current modeling, recognizing that our modeling is dynamic and our modeling is unique to the state of California, not necessarily trending with other parts of the country. We'll then talk about the issues of schools. As a parent, that's top of my agenda and top of mind, and I'm pleased to be joined today by Superintendent of Public Education, Tony Thurmond, and by Linda Darling-Hammond, the President of the State School Board. We'll also update all of you on some guidance we have around facial coverings, and then we will happily, of course, answer all questions you may have. But let me begin with Dr. Galley and ask him to come up and share with you 2 slides that give you an overview of the way we are conducting our planning exercises and how we are applying our prioritization as it relates to accessing resources and give you a sense of where we think we're going over the course of the next number of weeks and then well into May, potentially June and July. Dr. Galley?
Thank you, Governor. Let me begin by reminding everybody what we're up against. We have a brand new virus to the globe. We've been watching it and tracking it over weeks and months now, and we know that we don't have treatment. We don't have treatment at scale. We don't have a vaccine. So the most important thing we can do is stay home and save lives. We've been talking for weeks about models. We've been talking about flattening the curve, and today I'm going to talk you through how California has been looking at it. I want to remind you that nearly 3 weeks ago, we began issuing guidance, first around limiting the number of people in mass gatherings, then a few days later, issuing guidance to protect our vulnerable populations, seniors, those people who are homeless, those people with underlying conditions, and then a few days later, limiting mass gatherings even further as an indication that we were methodically and thoughtfully implementing physical distancing across the state. We then, on March 19th, issued the stay-at-home efforts across the state. augmenting what lots of local partners did as well. And it was all based on models and considerations that we've been tracking and thinking about since we learned about COVID-19. We welcomed Americans home on those repatriation flights. We took people in off cruise ships, and we prepared as a state for what we're facing today.
Thank you, Doctor. So it just reinforces the focus of our efforts. Again, the prioritization of our day-in-day discussion interaction is the issue of hospitalizations and ICU beds. Roughly, hospitalizations to ICUs are running about 41, almost 42%. If you extrapolate that out based on the graph that was just provided in the model, we'll exceed that phase one surge capacity of 50,000 somewhere in the middle part of May. And if you get up to about 66,000, that's based upon our current modeling, we're looking at about 27,000 ICU beds that we'll need to procure in this state. The good news is we have time, and that's why it's incumbent of all of us to utilize this time thoughtfully and judiciously. And what I mean by that, continue to practice safe physical distancing. Stay home, connect with others, make sure we're doing the neighbor-to-neighbor program, which we discussed yesterday, making sure we're checking in on our seniors, but no greater impact on changing that curve, buying us more time to prepare for this surge and for that peak than physical distancing.
That was Governor Gavin Newsom talking. He was providing an update to the coronavirus pandemic here in California. Well, you can continue watching Governor Newsom's whole live stream on our Facebook page. Well, the number of confirmed coronavirus cases in Kern County continues to go up. And a new update 2 hours ago, 110 people have tested positive for COVID-19. That's 9 more since yesterday. We also know at least 7 people had to go to the hospital because of the virus. More than 1,800 people have tested negative, and there are more than 1,200 tests still pending. Well, new today, Kern Public Health has released the age ranges of those confirmed cases. There are 2 people aged 0 to 17 with the virus, 51 for ages 18 to 49, 33 for ages 50 to 64, and 21 for ages 65 and older. This list does not include those 3 residents who have tested positive. And we still see most of those cases coming out of the western half of Kern County. 21 for the Valley, 57 for West Bakersfield, 22 for East Bakersfield, 2 for the mountain areas, and 5 for the desert areas. California Highway Patrol says about 7:30 this morning, they got a call about 2 big rigs that crashed onto northbound I-5 at Levick Road. They say a tanker truck was carrying a toxic substance which spilled. The entire interstate was shut down for hours, but about 45 minutes ago, CHP opened the southbound lanes. The northbound lanes are expected to be closed for several more hours. They say a tanker truck was carrying ferric chloride, a toxic substance which spilled. CHP says they have a hazardous materials crew on scene cleaning up that spill. They say they won't open the interstate until hazmat crews say it is safe. One truck driver had to be airlifted to the hospital. No word on whether anyone else was injured. And the number of coronavirus cases here in Kern County continues to go up. 110 people have tested positive for COVID-19. More than 1,800 people have tested negative, and there are more than 1,200 tests still pending. New today, Kern Public Health has released the age ranges for those confirmed cases. There are 2 people aged 0 to 17 with the virus, 51 for ages 18 to 49, 33 for ages 50 to 64, and 21 for ages 65 and older. This list does not include those 3 non-residents who tested positive. And Hall Ambulance Company is working hard during the coronavirus pandemic. When the outbreak first started, the company took extra safety measures. One such practice is taking extra caution to deal with someone who could potentially have COVID-19. If the ambulance picks up someone who may be tested positive for COVID-19, the ambulance is taken out of the fleet for a time while it is thoroughly cleaned, and all employees are screened before starting their shift to see if they are exhibiting any symptoms of the virus. And a local business owner is encouraging others to channel their anxiety into kindness during these uncertain times. The owner of Local Farm to Table has started a kindness challenge. She encourages customers to leave a post-it note on the hope wall of the restaurant while they're waiting for their food, and there's more.
You can repost the image that I posted on our Instagram page. It says kindness changes everything, and you can perform an act of kindness. It can be free, an act that's free, just letting somebody go ahead of you in line at the grocery store, or writing a joke for your mailman. Like, it could be anything that you want it to be, and repost that, what you did, and hashtag Be Kind Bakersfield.
This is Alex Fisher from the 17 News Center. The wall behind the restaurant on 18th Street also reflects the notion that kindness changes everything. A local nursery is encouraging kids to continue to grow even while they're away from the classroom. White Forest Nursery is giving away free seed packets to kids this upcoming weekend. Owner Jerry White says it's a great way for kids to do something fun and learn at the same time.
It's a learning experience for life as well. When children or even adults learn how to plant and see things grow, it takes the stress away. It's a great activity. It's very safe. And let me tell you, it pays big dividends in the future.
White Forest Nursery is located at 300 Morning Drive. The giveaway is Friday through Monday. It's an opportunity for students to ask direct questions to our industry's employers and get their foot in the door to their dream job. BC hosted its Industrial Technology and Transportation Virtual Career Expo via Zoom today. Employers were available to provide one-on-one consultation for participants. Well, we are continuing to see a jump in cases in Kern County. What can we do to limit the spread of coronavirus? We'll explain after this. Welcome back every morning on 17 News at Sunrise. Dr. Hamel Cothry, he's the Chief Medical Officer for Dignity Health Central California Division, joins us to talk about how we can keep the positive number of COVID-19 cases down.
If you're sick, we're encouraging you to stay at home. We're still getting people come into work when they're sick. So please stay at home. Wash your hands, practice all the hand hygiene things we've talked about. And the big one also is, avoid touching your face.
Do you think people aren't taking this seriously enough?
I really don't. I think there's, a lot of the states are starting to, figure that this is real. We're still seeing several parts of the country that really aren't practicing these safe measures.
What if you have to go out? We do know that there are still essential tasks and essential jobs. You need to go to the grocery store, those sorts of things. Banks are remaining open. When you go out and about, what should you be doing to protect yourself? Should you wear a mask when you are out performing those essential tasks like going to the grocery store? We've seen people doing that, but we've heard that we shouldn't because we wanted to save those masks for our medical professionals. But yesterday, President Trump talked about wearing a scarf instead over your mouth and nose to get protection, but not take away from supplies.
So these are such dynamic times. If you would have asked me this last week, I would have said, don't wear a mask. CDC keeps updating their guidelines, and they're now saying protect yourself as well. We are now starting to see about 25% of the people that come out positive are asymptomatic as well. So the mask is not only to protect you from other people, but we're also seeing that there may be some protection to you as well. And those are brand new guidelines that just came out a day and a half ago.
So what does that mean? Should we go out and buy masks? Should we just use scarves? And what's the proper technique?
So, we're, like you said earlier, we really are trying to save the masks for healthcare providers. We are changing guidelines in the hospital. As of yesterday, we changed them. So we are going to be running low on masks. We're looking for more masks. We're asking the federal government to get us more masks. So in cases of home people, a scarf over your face would be fine. There's a lot of people that are making cloth masks. That's fine as well. But try not to go out and get masks that, the healthcare professionals, the people working on the front lines could be using.
Do you think that people should wear these? The general public should wear these when they go out to the store at this point?
You can, but we caution you because what happens is there's a right way to put on a mask. There's a right way to take off a mask without infecting yourself. If you don't have those things right, you can actually put yourself at a higher risk. There's a 13% higher risk if you wear a mask and not know how to use it.
What does that come from? How is it more dangerous?
The reason is, so if you have this coronavirus on your hands and you touch the mask, you have now infected the mask. What we tell our healthcare workers is, as soon as you do that, you've got to take the mask off and you got to discard it. A lot of the common folk will be out in the grocery stores, will be touching the carts, touching their faces, and keep going. They have now got a higher risk of self-infecting themselves.
So if you do use something like a scarf, you need to come home, remove it, discard it into like the laundry immediately and wash it before we're using it, and then wash your hands?
Absolutely right away. And you take it off from the back. You try not to touch your face. We also tell people, before you touch the mask, wash your hands before you take it off and get rid of it.
Okay, and then wash it to reuse it. Again, things changing minute by minute. Let's talk a little bit about what's going on in our state right now. Johns Hopkins is reporting 8,558 cases in California this morning. And experts are starting to say that perhaps California's quick action to implement social distancing and shut schools down and other businesses like that are starting to show that they're working and starting to slow the spread. Are you seeing that trend? What does it look like?
So, we're still a couple of weeks behind states like New York. And so I think doing those things will definitely help. So we will really know that if this is working in the next 2 weeks. If we can minimize these cases, the better off we are. So we need to really put an effort into doing these things we've been talking about.
Thanks, Alex, for that. And we're back with more right after the break. Well, taking a look around the nation, a state district judge will hear arguments by abortion providers and the American Civil Liberties Union of Iowa today. This comes after Governor Kim Reynolds enacted an order to halt all elective and non-emergency medical procedures during the coronavirus pandemic. This includes abortions. The ACLU of Iowa says Reynolds violated the state's constitution. Reynolds will be represented by the Iowa Attorney General's office. The telephone hearing is set to take place this afternoon. Well, student athletes affected by the coronavirus pandemic now have another year of eligibility. What the NCAA is doing to make sure everyone gets to play. Sports is right after this. Welcome back. Well, the NCAA athletes will get another chance to take the field. Spring seasons for numerous sports were canceled early due to the coronavirus pandemic. Well, among the affected programs, baseball, golf, lacrosse, and softball. But now those players are being granted another year of eligibility. Division I schools will have to decide how their programs will manage scholarships. Well, with much of the country under guidelines to stay at home, you might be experiencing some cabin fever. Well, today, get out and go for a walk. Just make sure to keep your distance from others. It's National Walking Day. The first Wednesday in April is observed every year as the perfect time to experience some nature and stretch your legs.
This is 17 News with continuing coronavirus coverage.